The information provided on lifeinterruptedradio.com is for educational purposes only.
Welcome, everyone, to the Autoimmune Hour. I'm Sharon Saylor from SharonSaylor.com. And as always, it's my honor and privilege to be with you here on another brand new episode. Oh my gosh, we're coming into fall right now and it's getting chilly out. So I got my scarf and my sweater on. I don't know about you guys, still out able to get for a walk and all of that. But I'm telling you, I can tell the seasons are changing already. Oh my gosh. Anyway, I've got an amazing guest. We've had her on the show before talking about another topic, but tonight we're going to talk about fibromyalgia. And now, fibromyalgia isn't really classified as an autoimmune condition because it doesn't cause inflammation. They're calling it more of a neurological disorder. But I'm telling you, I don't know why it isn't, because it really is a chronic condition, a long-term condition in most cases. The problem with fibromyalgia is become what I call the kitchen sink disorder, meaning that when doctors don't know what else to call it, they just label you fibromyalgia, which isn't fair to what people really are going through when they truly have fibromyalgia, because a lot of people are being misdiagnosed and a real disservice. So we're going to have on tonight Dr. Dorothy Martin-Neville, and she supports people who have fibromyalgia with her wonderful website, curingfibromyalgia.com. And she has spent a lifetime trying to understand fibromyalgia as a clinical instructor at the University of Connecticut Medical School and co-chair of advisory board of a multi-million-dollar frontier medicine grant and recipient of an NIH grant funding for the quantitative and qualitative pilot study of the psychospiritual correlations of fibromyalgia. She's just spent years, as I said, merging the allopathic and integrative health. So let's jump right in, because there's so much to talk about fibromyalgia. Welcome, Dr. Dorothy, to the show.
Thank you so much. It's great to be here.
Now, Dr. Dorothy, the one thing that I am just frustrated about, because years ago I was told I have fibromyalgia. This was years ago. And when I looked up the symptoms, I could only check like 2 of the boxes, but the medical community just wouldn't go any further. Like, oh, label, you're done. Yeah. Why is fibromyalgia so hard to diagnose?
It's hard to diagnose, I believe, because one, you can't see it with an MRI. You can't see it with a CAT scan. You can't see it with x-rays. It is something that exists in the body. Pain is real. It is physical. And yet if the doctors can't find a cause, they want to believe the pain is more emotionally caused, more emotionally based. And therefore, there's nothing they can do about it because they don't deal with emotions. So therefore, it's like it's this thing that they push in the corner they don't know what to do with. I've also spoken to a doctor. She called from, she's an emergency room doctor, telling me that many of her associates, herself included, have no clue what fibromyalgia is.
Wow.
Because folks come into the emergency room saying they've read what we know, that if you have these 18 points, many years ago, backing up a moment, many years ago, rheumatoid arthritis and fibromyalgia were blended, that nobody could tell the difference. So many early fibromyalgia patients were labeled as having rheumatoid arthritis. At some point in time, the doctors developed an 18-point diagnostic scale, so that there are 18 points starting in the forehead, the top of the forehead, down either side of the brain, and then down the spinal column, out to the hips and down the legs. And there's certain lines there. And there are 18 points. If 16 of those that the doctor presses are considered acutely painful, you're diagnosed with fibromyalgia. And so they put that aside. We now know if you've got 16 out of 18 that are acute, we're going to label this fibromyalgia. So the doctors figure, I've got this understood. This is what fibromyalgia is. Even though I don't understand it, I know how to identify it. Period. It's simple. It's easy. They've got it. Just as with diabetes, if these are your readings, we know you have diabetes. It's a very clear, distinct delineation of particular disorders and diseases. However, with that put aside, we have these 18 points and you've got it. That's okay. Patients go into the emergency room and they will say, my eyes are bothering me, or my skin is itchy and it's my fibromyalgia. a doctor can't say yes or no. They have no clue because that is not at all what they have been told fibromyalgia is. And the patient insists, this is my fibromyalgia. 20 minutes later, another patient comes in and says, my feet are swollen and my knees hurt. That's fibromyalgia. Then 20 minutes later, another patient comes in and says, I'm feeling nauseous and I can't eat. It's fibromyalgia. So the doctors are throwing their hands up in the air and saying, what's fibromyalgia? We thought we knew what it was based on, as with every disorder and disease, a clear delineation. This is what the symptoms are. If all of those are symptoms of fibromyalgia, how does a doctor treat fibromyalgia? They
Great
don't
question.
know. Right. So they're in this quandary of, I don't know what to do because I don't really know what it is. And unfortunately, especially now with certain online medical websites, a lot of patients are self-diagnosing. They self-diagnose with every kind of imaginable disease under the sun. But they may go on a fibromyalgia support line in Facebook or someplace and find out that somebody there has 12 different symptoms. And they say, I have those 12. They must all be fibromyalgia too. Now we can join together with fibromyalgia. And so now they're reaffirming things that have nothing to do with fibromyalgia, throwing it into this bucket or this kitchen sink and saying all of this are symptoms of fibromyalgia. For me, the really unimportant, the important and unfortunate aspect of this is that if you're told fibromyalgia is a chronically debilitating disorder that gets progressively worse, one, I don't believe that for a moment, but if that's what you're told and you believe it, and then you feel my bad eyesight, that's my fibro, well, then why get it treated? It's part of your fibro. It's going to get progressively worse. It's chronic and nothing can be done for it. Okay, so now I also have a bladder infection. Well, that's part of my fibro. Why bother getting treated? I already know fibromyalgia can't be treated and it's going to be chronic and progressively worse. So you have all of these other absolutely unrelated conditions that have nothing to do with fibromyalgia. That if you went to the doctor with that bladder infection, he or she would treat a bladder infection and you could be rid of it in a couple of days. If you have problems with your eyes and it's not fibromyalgia, you would go to the eye doctor and be treated. But if it all gets thrown into the fibromyalgia package, you have permission to fall into this emotional state in which you give all of your power away to a disorder that doesn't even exist in the context in which you see it.
Wow. That's very common with a lot of autoimmune conditions as well. People would say something. For me, I was having problems sleeping, and I mentioned it to my rheumatologist, and we had the discussion, is that menopause? Is that stress? Is that my autoimmune condition? And it was very eye-opening when she threw out all these other opportunities for someone that was having trouble sleeping, when I went, wow, I have to get out of that mindset of everything going into that one label that has been put on me.
Right. And unfortunately, many other autoimmune disorders there's far more understanding about it than there is with fibro. I'm not saying complete understanding, but more understanding. And with fibro, patients are really, as I see more and more, I listen and participate in, I have my own Facebook page, which is Curing Fibromyalgia. But I also watch and listen and participate in many other pages. And I find it so sad that a vast majority, certainly thankfully not all, but a vast majority of folks are giving all of their power up, all of their self-determined up. They are just ending up as victims sitting in a chair, waiting to see what other symptom fibromyalgia is going to develop as it takes over their lives.
Yeah, it becomes their identity, which is all too common with any chronic disease.
Right. They begin to disappear, and the only thing that exists in their lives is fibromyalgia. If they are going to heal, the absolute opposite needs to take place. And even if they don't heal, if they are going to minimize the disorder, and it can be minimized or healed, they need to begin to see that they exist right here in their life. They're over there on the other side of the room. There is fibromyalgia. There is their spouse or lover, whomever. There is their children, their family, their career, if they have one, all of their friends in their home. But they're over here. They are not fibromyalgia. And no one element of their life is more powerful than they are in their life. And we really need to get that message across, which is why going on podcasts such as this and others allows me to present that reality, this embodied soul, embodied essence, however you see yourself spiritually, this being right here is on a spiritual journey. All those other factors over there are a part of the life you have created, but they are not your life. They are not you. They are elements of your life you have created. And if we can remember that, we realize I am the powerful element that brought all of this into my life, consciously or unconsciously. And we then can recognize it is just a disorder. And not for a second do I want to minimize the pain, the discomfort, and so forth. But it's just a disorder. How can you either change its impact in your life or eliminate it? There are others I have worked with, many I've worked with who no longer have fibro. Others I know who change their diet, who begin to exercise even when they're in pain. They begin to exercise, they change their diet, whatever that means to them, and everybody's body is different. You know, the Atkins diet, the vegan diet, the vegetarian diet, nothing is right for everybody. What works for your body? And this means you have to be willing to put the energy into you to look at what works for me.
I love that. I love that. You know, I've said a lot of times that in the medical community, I want team members. I don't want prescriptors who point the finger and shame and blame and guilt me into their particular way, because, like you've said, I've tried numerous things, and some work, some didn't work at all, and some worked halfway or partway. And it's been amazing to me that I can talk to other people and they'll have completely different regimes, health regimes that work for them. I want to step back for a minute, though, with this 18 points. Is that still the norm, or how is fibromyalgia diagnosed? When I was diagnosed with my autoimmune, for a few years before, I had these vague symptoms. And as one of my beautiful medical team members put it, well, Sharon, we know something is wrong. We can all agree on that. But until you get a symptom that sort of bumps it out of this vague set of symptoms that are quite common to a variety of things, we can't label it. So how do we know if we've got pain and discomfort and some of these things of fibromyalgia? How do they diagnose it today?
Many of the doctors still do the same 18-point diagnoses. Other doctors, unfortunately, it's a matter of deductive reasoning.
So it's not everything else. It's
right. It's got to be
kitchen sink.
We've tried this. You don't have that. We've tested for this. You don't have that. We've tested for this. You don't have that. Let's go with fibro. Okay, I have fibro. The doctor said I have fibro. Actually, he did or she did. But if you listen, what they really said was you don't have all of these.
Right. We don't, what they all said was, we don't know, but we need a label.
We need a label. So let's go with fibro, because none of these others fit you through all of the testings we've done. There is no other way to test you other than the points. And since nothing else fits, you have fibro. So now you can sit down and acquiesce and fall under the burden of having fibro, and then let everything else come on top of it. And unfortunately, and I put this out there on occasionally on certain pages, and it's not for a moment to minimize, but somebody will say, I can't sleep. Lately, this past 2 weeks, I've been waking up 5-6 times at night to go to the bathroom. Is that fibro? And I wrote, that's life. Lots of folks who've never even thought of fibro are getting out 3 or 4 times at night to go to the bathroom. When's the last time you had water or tea or wine, or I don't care what you drink, what fluids you drink? Did you stop drinking fluids at 11 o'clock at night, or did you stop at 7 o'clock at night? Let's start with that. Let's take fibro off the table every time a new condition develops. And that truly is my advice, is my desire. Take fibro off the table. Let's look at some logical, simple solutions to many of the issues that evolve. And you may find that instead of giving power of fibro to everything in your life, it's nowhere near as powerful and significant as you're making it.
Yeah, I think that's true with whenever I call it the white coat authority, but I see it with autoimmune as well. The white coat authority goes, you have, in a very powerful way, sort of like anointing you, crowning you with this thing. And I've told this story before on the show, and I argued back. I said, I'm not taking ownership of it. And that was not for the doctor. That was for my own unconscious brain to go, clear, cancel. That's not going to work. And they looked at me very strange and like, get real. And I said, look, I can have cockroaches, but that doesn't mean I own them. The way it was just pronounced to me was just an anointing me. And I don't want my body, my mind, my spirit, my emotions to accept that I have this thing with this dreadful list of outcomes as the rest of my life. I will beat it. And I will overcome it. And I think that's critically important for us to understand about even how we language, which is what a part of I'm hearing you talking about, how we talk, how we language, how we think about the diagnosis has a critical point of how we physically feel with or without the label.
Our bodies hear what we say. Our bodies absolutely hear what we say.
And what we think. I want to throw that out there too. They think we're talking to them even when we're thinking.
I agree with you. And when we reinforce in our own mind, I am a victim of this disease or disorder, we truly begin to walk with the burden on our shoulders. If we say, I've somehow contacted or developed this disorder, and I'll be working with it. What it says is, I'm working with that disorder. That disorder is not working with me. Right. I'm the one dealing here. All right. Which gives you permission then to say, let me try gluten-free. Let me try vegan. Let me eliminate animal fats. Let me eliminate alcohol or sugars. Whatever you choose to try. Because as we said earlier, in your body, that may be all you need. And somebody else, what they need to do is go to a Mediterranean diet and stick with it. And the moment they go off it, they pay a price. Well, now they know that works for their body. For somebody else, they know it's the 5 meals a day, 5 very small meals a day that works best for their digestive system. Somebody else, it's 3 meals a day with minimal animal protein or no animal protein that works best for their body. There's no one right answer. And we truly need to take responsibility. And I don't ever put blame out there. Welcome to humanity. We need to take responsibility and become our own physicians.
I like to call it my own medical detective here. Because I want to talk to you about, we were just mentioning diet, but I know that you and I have talked before about, it's not just diet, talking about eliminating toxic people, places, and things from our life.
Oh my God, yes.
Lowering our stress level, all sorts of things that we can try to continue to optimize that our body will respond to.
Stress is a major implicator for any disease, even genetically predisposed diseases. Stress is most frequently the activator. You can have, for instance, we all have cancer cells in our body, all of us. What causes those to be activated in one person and not another? My first question is always, what kind of stress are you under? Chronic, long-term, or acute stress impacts the immune system. When it impacts the immune system, we don't have the ability to resist what our bodies normally would just brush off, whether it's a food we ate that gives us food poisoning, at another time with a really strong immune system, and we may have just not felt good for a few hours, eliminated that, and we're perfectly fine. But if our immune system is shot, we could be in bed for 3 days because we were vulnerable to begin with. So we need to look at what are the major stressors in our lives. And I do differentiate. There can be great stress because I'm leaving tomorrow for a week in Paris, and I'm excited, and
I'm coming.
right, that stress feeds your passion. It feeds the energy flow in your body because it's really giving you life. You're coming more alive. That's a wonderful, healthy stress versus the stress that says, oh God, I've got to go home to an abusive spouse who's always angry, never happy, and will be putting me down for the rest of the evening. Let's look at what's going on here, or what's going on if you are somebody who says everything to the last minute and you're always in fight or flight. You're always putting out fires. If that's your personality, and again, there's no blame here, but just be self-aware. If your personality is always putting out fires, can you bring somebody in to help you create a new framework? To help you recognize there are no fires in life unless we create them. I raise my children to believe we have small problems and we have big problems, but we don't have crises. So this is not going to be a crisis zone where everything is a crisis. You can't find your hairbrush, everybody freeze. We have a crisis we have to deal with immediately to find her hairbrush. Let's back up. We have a problem. Is it a big problem or a small problem? Energetically, what that does for your body is enormous, enormous. So understand how you approach life. If it is packed with stress, take some time. Find some coping skills. Change your frame of reference, the way you see the world and the way you see you in it. That eliminates toxic people. It eliminates toxic situations. And it helps you to reframe things.
Absolutely. We need to take a quick commercial break, and not to bring on more stress, but during the quick commercial break, think of a few things, because one of the things I found, and we'll talk to Dr. Dorothy when we get back about this, is oftentimes it takes a lot of thinking to be aware of what is a stressor in our life, because it's been there for so long. So just contemplate that for a couple of minutes, and we'll be right back. We've been talking about fibromyalgia and what I like to call the kitchen sink disorder. So many times it's the sort of the label of last resort. And Dr. Dorothy's been sharing us what is fibromyalgia. And when we had to take that quick commercial break, we were talking about the stressors of life. And as you know, fibromyalgia, we mentioned beginning, is not technically an autoimmune disorder, but there are many, many things in common, and life stressors are one of those that can exacerbate symptoms. So Dr. Dorothy, one of the things I wanted to talk about was how to a coaching client one time that we were talking about this topic of what are the stressors in your life? Oh, none.
Yeah,
I haven't met anyone that says none.
How sweet and innocent.
Exactly. So as we got contemplating this, this idea of like, wow, absolutely no stressors whatsoever, I uncovered that there was an abusive situation at home, and emotionally abusive, verbally abusive, not physically. So it couldn't possibly be abuse. It couldn't possibly cause stress. And other situations, including a very elderly pet that was about ready to pass over. And I'm just surprised at how many people minimize what a lot of people would call stressors in life.
Well, because we are supposed to be completely understanding and accepting and unconditionally loving of everybody at all times in regards to everything. That makes us good people. Therefore, I have to block out any desire I may have to slap somebody, to yell at somebody, to react to somebody, because that would make me a not nice person. It comes down to the simplest of things when we look at stress. I know years ago, I used to meet a girlfriend every Friday night. We would go to the movies and then out to dinner. And I would get there first just because I like to be early. I would get there first. and I would wait. And she inevitably would show up about 15 minutes into the movie. And the first couple of times, I was progressively more and more irate, so that I either wanted to leave to show her she can't do this to me, or I wanted to just scream in the midst of the lobby and let her have it so I could humiliate her, embarrass her, because I was so enraged at her pattern of consistently being late. Until it dawned on me, thankfully it only took me 2 or 3 times to get this, until it dawned on me, she doesn't have an issue, you do. If you get to the movies and you like to get your seat before the previews start, long before the movie starts, why don't you go in, text her, tell her, I'm saving you a seat. I'm inside the movie theater. And so I could sit there in absolute peace. And if she showed up 15, 20, 25 minutes late, that was her issue, not mine. And we both understood if she walked in while the movie was playing, I was not going to turn around and explain to her everything that had already happened, annoying everybody else sitting around us, that she would just have missed what was going on. And once it dawned on me, all of this emotion, all of this reaction had nothing to do with her. This was a pattern I had where I know you're not supposed to be late. And if anybody else was, it was so inappropriate. It was wrong. It was bad. There was all of them. And it's like, whoa, whose story is this?
I love that. Whose story is this?
You know? And so once I could say, I'm creating a problem that doesn't need to exist. She's not creating a problem. I'm creating a problem that doesn't need to exist. And that's the part of ownership. I created a problem that didn't need to exist. Yes, she was consistently late because she lives in chaos. That's her piece. It has nothing to do with me. But I created a problem in this situation that I made it an issue. All I needed to do was say, I like being earlier on time. I'm going into the theater. When we look at that, and to me, the most important piece here in those who try to be good, when we look at this, let's back up and take ownership. I am reacting rather than responding to this situation. My reaction is not about anybody else. It's my ownership here. I'm choosing to react. What can I do to change my response to this situation? And when you notice others saying, but everybody would react that way. No, they wouldn't. Many may, but not everybody would react this way. Others would deal with the situation without reacting to it. So taking that ownership of what's going on in my life, whether it is fibromyalgia, whether it is patterns of stress that exist around me, I need to own that I have a smile on my face and then all of a sudden I blow. That there probably was a buildup taking place over here that I just didn't pay any attention to. And if I did, I never would have blown. And I never would have put all that stress on my body. I would have dealt with it way over here when it was beginning.
Now, I have a little mantra that when I feel that tension start to build, I said, not my circus, not my clowns, and just disassociate from the whole thing, going, not my clown. I'm just here.
Walk away, because that stress is doing absolutely nothing of good to your body.
Yeah. One of the things that I found helpful when I found my triggers, as I like to call them, was as I was learning to deal, okay, obviously this is a trigger of mine. I can feel things starting to build. What I found fascinating is I found certain people in my world, most of them family members, like, that's where I learned it from. Okay. Makes a lot of sense now.
But it also says, now that I've identified it, I can change it.
Exactly.
Right.
And sometimes little mantras help. What other things do you have that help? I mean, I love saying that to myself. Sometimes I actually say it out loud, but if the stress is that high. But what other things have you helped where people can begin to recognize and go, okay, that really isn't a big problem.
What I do is I work a great deal on meditation and on emotional intelligence. If I can support you for one, having permission, and amazingly, that's the important piece. If I can give you permission to stop for 15 minutes every morning and 15 minutes every evening to meditate, to just sit in silence. I don't care if you have to go into the bathroom to do this, to get away from the craziness. Take 15 minutes to stop. Catch up with yourself with that vision that I am here at this chair or this toilet, this seat, whatever it is. Out there is the rest of my world, including my spouse and my children and my career and all of that. I'm here. I'm taking time to sit with me, apart from the rest of that reality I've created, and just sitting in the silence of that, what's going on. When we do that, we can notice where we're holding stress in our body. We can notice where we're holding sadness in our body. We can know where we're holding fear. And we begin to recognize what those emotions feel like in our body. And if you take time to do that in the morning and in the evening, you find that it becomes a default. So that in the middle of the day, if there's a situation that's developing, in a very healthy way, you spiritually detach. You may not be able to leave the boardroom. You may not be able to leave your desk at the office, but you can spiritually detach for a moment. Remember who you are, and then come back into the situation at a very different, grounded, more present place to you, without an emotional investment in the situation around you, so you can stop and look at it objectively. And it really becomes a default, if you will, when stresses get high, that you spiritually disconnect for a moment and look at this from a place of absolute detachment, and look at you from a place of absolute detachment, and be present.
Mm.
And when you have the ability to do that, and you start developing emotional intelligence, that says, I know me so well, I know my emotions so well, that in this situation, I always get angry. In this situation, I always go into fear. In this situation, I always go into inadequacy. All right, so now you know that. How can you support yourself in creating a different response to each of those situations? Or, depending upon what it is, permission to never walk into those situations again. How can you support yourself? So to me, both of those, meditation and that emotional intelligence, that absolute understanding of who I am and how I respond or react, gives me the power, if you will, the authority to define the amount of stress I have in my life, and also recognizing where I need to change my belief systems and my patterns to something that supports my health.
I have a couple of things that came to my mind that I do when I meditate. I have a 14-minute piece of music that, whether I have house guests or whatever, they know that when that music is playing, there's some part of 14 minutes that we don't talk to Sharon, right? And so I like the piece of music for myself. I found it very routine to be able to get myself quickly into a place where I can sit with myself. But I also find that it's a lovely warning sign of like, okay, the music's playing. There's some part of 14 minutes I need to respect some boundaries here around that. So that's one thing, and short of locking yourself in the bathroom perhaps, but just having that preset, okay, everyone knows that's a 14-minute piece of
and that's
music.
what you're going to do. That to me is so emotionally healthy, that I know me so well that I know when this is starting, if I put this on, it's going to bring me back down to a place where I'm much more at peace in my body. That's the result, if you will, or the demonstration of your emotional intelligence. You understand what's going on, and you know how to work with it immediately so you don't go off the rails. You bring yourself back to a place where you want to exist. That is phenomenal. I have I know when I go into moments, and thankfully that it's not often at all, of feeling overwhelmed or depressed or something, I run upstairs. In my VCR, I have Mamma Mia. I just listened to 10 minutes of Mamma Mia, and I am as happy as could be. And I am singing the songs as I walk back down the stairs and come into my office, and I am in a great place again. It's what works for you. What works for you. If you have something conditioned, you know, you don't have to sit and feel lost like, I don't know what to do with this. I have already prepared myself. If this is what I'm feeling emotionally, I can take a deep breath and change my perspective and see it's my perspective on this. If that doesn't work, what do I need? Well, plan B is I'll go upstairs for 10 minutes and watch Mamma Mia. You know, what is it for you? Learn what that is. It's a gift you give yourself.
Well, actually, yes, it's a gift you give yourself, and it's also a gift you give family members. When Mamma Mia, or in my case, my 14 minutes of flute music, it's a fair warning label as far as I'm concerned.
Oops. Yeah, it's like, let's quiet down and back off slowly.
It's sort of like, fair warning. We had Dan Millman on a few weeks ago, and he shared with us, and I had actually read it in some of his wonderful books before, so I had been using it for a long time, but I appreciated that he shared these 4 words that I like to have mantras for when I need them in emergencies, and it was that I repeat often, as well as the Not My Clown mantra, but they were breathe, relax, here, now. And when I say them very matter-of-factly to myself, in that sort of pacing that I just used, all of a sudden I just feel the whole body, it's been trained to respond to those 4 words. And that's what I find really helpful too, is having these things that you repeat over and over. In that case, your Mamma Mia, in my case, the music. And then where I can't play the music, those 4 words just brings me back to the present moment.
Right. And for myself, it's take a deep breath and disconnect. Spiritual detachment. Take a deep breath.
Let's talk about breathing, because obviously we both had breathe in there. Let's talk about the amazing healing power of breathing for a minute.
And consciously breathing. I mean, thankfully, we're all breathing constantly. But when you consciously breathe, it almost calls you to sit up. You know, I'm going to take a deep breath. I'm going to sit up taller, sit up straighter, and let my lungs breathe in. Just doing that, coming from a slouch, or when we can slide down in our chair, or whatever we're doing, when we consciously choose to sit up straight, we've already energetically shifted our bodies. All right. We've already energetically shifted our bodies when we choose to sit up straight. Taking in a deep breath causes me to focus on my lungs and my body, which causes me to do what I talked about earlier, disconnect for the moment from everything else around me. I'm going to stop and breathe. All I'm focusing on is my breath. And in doing that, I have taken the stress down, and my investment in winning or in proving a point or whatever the case may be, I've disassociated. I've taken a breath, stepped back in, and I may want to stay here because it feels so much better than stepping back out there, and I may want to take a few more breaths and just be back here with me. And I think truly that breath that causes, at least my perspective, that breath that causes us to focus on us in the midst of a stressful situation allows us to see the situation differently, because our emotional investment leaves during the times of breathing.
Wow. I'm just relaxed. Just thinking about breathing, makes you breathe deep, and watching Dorothy on the video here, seeing her breathe deep, my body automatically responds. We need to take our final quick commercial break. So everybody, let's just concentrate on this commercial break and focus on our breathing, and we'll be right back. Now, Dr. Dorothy, on your blog, I was reading this wonderful article you recently wrote about the fibromyalgia personality. Can you share a little bit with the audience about what that is?
Certainly. When we look at the 18 points that are being used to diagnose fibro, Not coincidentally, many of those 18 points are either on the bladder meridian or close to it. In the bladder meridian, in Eastern medicine, the water element, which is kidney bladder, relates to fear. Bladder is the yang, it's the masculine element, and it is fear around an inability to protect someone, all right, to protect someone else. Kidney disorders really become about at a time when we're fearful around protecting ourselves. We lose a job or we're getting a divorce, and how am I going to make it? Oftentimes, kidney issues may develop. Bladder takes place when it's inability to protect somebody else. What I did years ago in doing some research was look at point of onset. When does it start? What causes the outbreak, if you will, of fibromyalgia? And what I discovered is that it is when a child, and 97% of those with fibro are females, all right? So when a child goes away to the first grade, mom's not able to protect that child. And this mom has all of this stress, all of this anxiety that gets held in the body along the bladder meridian. So that, because meridian channels are like garden hoses that run through the body. There's yin in the front of the feminine and the masculine, and the yang in the back of the body. And so it ends up that fear around that inability to protect her child. What if she falls down? What if she's lonely? What if she's sad? What if she misses mommy? I can't do anything. And now this angst builds. It can happen when a child gets married and moves to the West Coast. You know, we're here on the East Coast. It can happen when a child goes to college in Chicago. What am I going to do? And the fear and the anxiety becomes enormous for this particular client, you know? And so when you notice that point of onset is around that inability to protect, and I look at the client herself, frequently the child comes from an early childhood in which, whether it was sexual abuse, physical abuse, emotional abuse, it doesn't really matter. Everybody experiences them differently. And this child experienced all of this and felt unprotected, and consequently, in many ways, felt unloved. So in growing up as an adult, they develop a belief that when you truly love somebody, you protect them. If I had been loved, I would have been protected from that abuse. I would have been protected from those people who did all those things to me. And therefore, when I love somebody, I'm going to protect them. And frequently, unfortunately, because of coming from that kind of an environment, there is very little sense of any personal value, any personal worth, any personal quality. We're simply existing and being in a relationship, finally having something to do, finally having a purpose of loving and protecting the one we love from all anger, all sadness, all fear, all loneliness, all failure. We now have something to do. And that becomes our driving force. And so when you take that away, because of college, because of high school, because of marriage, whatever it may be, where's my significance? Where's my value? Where's my worth?
Wow.
How do I prove my existence? And I had a woman come in once and say to me, well, you're completely wrong because I don't have any children, and yet I have fibro. And I said, well, I could be wrong. I'm more than willing to keep learning. This is what life is about. It's continuously learning. And I advised her at one point, she was so stressed, just to go away for the weekend, to get away, give herself a break. She went away and came back on Monday and was enraged at me because I had ruined her entire weekend. When I asked what I had done that did this, of course, as a therapist, you just take all that in. And years ago, I was a therapist in private practice, seeing 42 patients a week for many, many years. And asked how I ruined her entire weekend, since I don't even know where she went, you know. And she said, I put my mother in a nursing home 3 months ago. And before I went away for the weekend, I got friends who volunteered to be there for breakfast, for lunch, for dinner, and at bedtime, to make sure she got her meals, to make sure she got her medications, and to make sure she didn't fall out of bed. And I spent the entire weekend in terror that somebody wouldn't show up, that my mother would fall out of bed, she would be hurt, she would miss her meds or her meals, and feel absolutely alone and abandoned. And I never would have gone if you hadn't encouraged me to go away. And it made it so clear to me, as I pointed out to her, she was in a mother-child relationship with her mother. And the same fear about the inability to protect, even though she put all of these things in place, it was ultimately her responsibility to make sure her mother was happy, to make sure her mother was fed, even though she was in a nursing home, that she really liked, that she was happy to have her mother in. And so, again, I repeatedly saw that when that is your personality, when that is how you do relationship, it isn't just your child. You bring that into your coworkers. You're the one who'll be up all night if you know a coworker's having surgery the next day. You'll be up worrying and praying and bringing in cookies and birthday presents and things. If somebody's going through a hard time, bringing in a little gift to make them feel better, because you take on the responsibility of helping everybody, and it's a very loving, giving personality, but it also becomes a very controlling, overwhelming personality, that when you finally develop fibromyalgia, you demand that people love you the way you love them, that they protect you from all the ramifications.
That's fascinating. We've discussed the implications of trauma, past traumas, current traumas, on helping lay the groundwork of the situation for an autoimmune condition as well. And the one that came to mind as we were talking about the woman and her mother was, we had Sarah Payton on recently talking about how we talk to ourselves and uncover these unconscious contracts, and she calls them sacred vows we make to ourselves, most often as children. Like
In our
that we're
innocence.
that we're not even aware of. And so if you guys are interested in what Dr. Dorothy was talking about there, check out Sarah Payton's show that we did several months ago now, but it's called Unconscious Contracts and Sacred Vows. Just go over to understandingautoimmune.com and put that in the search bar and you'll find that show. Because if that resonated with you, Sarah walks us through a demonstration on the language we use with ourselves, not only to uncover them, but to release them. And it was profound. And if you watch the video, I'm laughing at myself here. If you watch the video, you'll also see that I was mesmerized through parts of it, because the language is speaking to our unconscious. It's not for our conscious brain to hear. It's a fascinating show. Not just the physical symptoms, that there's so much that plays into it, the emotional, the mental, and the spiritual. What else have you found about that? I'm thinking about things like cellular memory and the patterns that we create in our life. As you walked me through that, I'm thinking, well, some of those things about being the nurturer, the helper, whatever the terms we want to label ourselves on that, are really patterns that we've created throughout our life. And are there ways that we can become aware for ourselves?
There certainly are. There certainly are. If you find, and again, if you're willing to stop and observe yourself, that means I'm not living in reaction to all the outside stimuli. I'm actually watching me. I'm not reacting to, I'm observing me as I go through my life. You will begin to see patterns of behavior. And when you do, start noticing, what are you thinking? What are you feeling? What is your belief around that pattern of behavior you have developed? And if it is, it can be the most minute thing. Somebody is going to put a glass on a wood table, and it's not even your house, but you run quickly and get a coaster and put it on the table. Why did you do that? Again, not critical. Again, let go of blame and critic and right and wrong. Just observe. Why did you do that? Because in your world, they were going to get punished. In your world, they were going to get disciplined. Where did that come from? A belief back when you were a child that you don't do anything wrong, that it's selfish of you to damage somebody else's property, or it is inconsiderate of you to never think about everybody else, or it is wrong for you to just think you're so special you can do something. And where did that message come from? And this isn't even about the person you were rushing to protect. Where did that come from? And then notice, how many other times do I do that? How many other times do I rush and protect people to not get into trouble? Even if I'm 40 or 50, when I become that 5 or 6-year-old child in that emotional state, I'm looking around to make sure mom and dad doesn't get angry.
Oh my gosh, Dr. Dorothy, we have to leave it there. I wish we had more time, but just this idea of becoming aware. Thank you. That was powerful as well. We're down to the last 2 minutes, Dr. Dorothy, and I want to make sure everybody has time to know about you and your work and the website. So please share with us in just these last 2 minutes the how people can get a hold of you and learn more about this.
Thank you. I do have my website, curingfibromyalgia.com. I have a Facebook page, actually, Curing Fibromyalgia. And I have a wonderful book out there. I wrote it years ago, but it's becoming so much more present right now. And it is called Your Soul Sings, Your Body Dances. So when your soul is happy and vibrant and alive, you will have your health. You lose your health in proportion to the ways in which you give up your happiness, you give up your freedom, you give up your joy. And that creates an environment filled with stress or sadness that impacts our immune system and makes us more predisposed to disorders of whatever type, depending again on our personalities, on our life systems, where we hold our stress. And in addition, if they go to my website, askdrdorothy.com, they get so much more material. They can sign up for my newsletter, and they'll be getting lots and lots of information as I go forward. I go out and speak. I love speaking on this as well, doing workshops, keynotes.
Wonderful, wonderful. Everyone, that's Dr. Dorothy Martin-Neville, and she's at curingfibromyalgia.com. Thank you, Dr. Dorothy. That was powerful, a great understanding. And I could see so many places that we related, not just to fibromyalgia, but to our overall health and as we walk through the autoimmune journey. So everyone, join me next week for another brand new episode. And have a great week, whatever your adventures. Enjoy.
The information provided on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio, including the websites understandingautoimmune.com and lifeinterruptedradio.com, plus social media, is for educational purposes only. What you read, hear, and see on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio, and its websites, and other media outlets is based on experience only. The information should never be used for any legal, diagnostic, or treatment purposes. Always seek sound legal, medical, and or professional advice regarding any problems, conditions, and any of the recommendations you see, hear, or read here on the Autoimmune Hour, Understanding Autoimmune, and Life Interrupted Radio.